There has been a tremendous amount of reporting in recent years on the links between concussions, traumatic brain injuries, and suicide. It's often associated with professional and career athletes, yet these injuries expand well beyond that elite circle, we're learning. In fact, nearly 2 million Ohio adults have suffered a TBI in their lifetime. Recovery can be long and difficult, and it's why the Brain Injury Association of Ohio was formed back in 1982. So we have Executive Director Lauren Holly with me today. So good to have you on the show with us.
Thank you so much for having me.
Let's start with kind of the mission, the advocacy behind your organization. Lauren, what is it that you do?
Sure. So we have been around for nearly 40 years now, and we really serve the whole state of Ohio, survivors, caregivers, and professionals in a lot of capacities as well. And we strive to make a better future for survivors through education, support, and advocacy. So we're out there making sure that survivors have access to community resources, access to appropriate medical care, and making sure that not only survivors and caregivers are educated, but also the professional community.
I never realized how prevalent brain injuries could be, and I think it's because we're learning of all the things that kind of qualify as a brain injury. So bring us up to date. Tell us about, what actually is a brain injury considered?
Sure. So a brain injury can result from a multitude of things, just as you had just mentioned. So it can be related to a bump on the head during a sporting event. It can be related to a motor vehicle accident, a fall, a drug overdose. It can be related to domestic violence. When you think about somebody in that type of situation being hit in the head or strangled and that lack of oxygen to the brain, that's very impactful. So brain injuries can happen in just a multitude of ways. A stroke is considered a brain injury as well.
And let's talk then about that link that you're seeing between kind of the mental, well-being or mental concerns in somebody who suffers a traumatic brain injury. Where does that link happen, and what are you kind of looking at as far as the research is concerned?
Sure, absolutely. So there's a link between the brain injury and possible concerns afterwards because of the severity of symptoms that can happen and the longevity of those symptoms. So brain injury used to be thought of as something that you sustain that brain injury and within a couple weeks your symptoms resolve and you move on your merry way. Well, now we're really seeing that brain injury can turn into a chronic disease. So folks can be suffering with these symptoms such as fatigue, headaches, difficulty thinking, pain, for years after their injury, which can really take a toll on their mental health. And we know that within the first 6 months of having a traumatic brain injury, folks are 3 times more likely to have suicidal ideation. And we really suspect that's related to all of those symptoms that come, following a brain injury. And even after that first 6 months, for years after, they're at a higher risk of suicidal ideation just because of their brain injury.
Wow, it's interesting, and it's interesting, that you then provide them some kind of help. What are you seeing as far as, I guess, the outcomes of this? When people come in and they find out, right, there is a place for this specific treatment for me to get better. What are you seeing?
So we see that we can help folks live well with their brain injury, right? Make sure they get to appropriate medical care, that they get to medical professionals that are versed in brain injury and how that looks different and how to differently treat that. So we're able to connect them to those folks. We're able to get them into support groups where they're able to see that they're not alone, that there are other folks that are going through the exact same things that they're going through. So we see them being able to live better with their brain injury once we get them connected to those resources.
And you have a hotline. You don't always think of maybe a brain injury as being something where somebody needs kind of that immediate connection, but what are some of the questions, what are some of the calls that you field?
Sure, a lot of times the question is, this is what I'm experiencing and is it normal? So we talk about, what is normal to experience with a brain injury, who to contact for help, who are the medical professionals that are going to help with your current concerns. We work a lot with connecting folks to community resources. So maybe they've been out of work for 3 months because they sustained this brain injury and they've lost their housing or they've lost their job. Helping folks get housing, access to food, help with employment, connection to benefits. Those are a lot of the things that we address on those calls.
I want to talk about part of your mission, the walk, roll, run, right?
Yes,
Tell me a little about this.
So we're having our 2022 Cerebration Walk, Roll, Run, and it's an event to bring awareness to brain injury in the state of Ohio, as well as to help support all of our free programs for survivors. So it's going to be October 16th, and it's in person at Battelle Darby Creek Metro Park in the area, but also virtual so that folks can participate from anywhere. Lots of exciting things happening. We're going to have prizes for the largest team, the team that raises the most funds, questions. And in person, the day of the event, we're going to have family activities, refreshments, raffles. So it's going to be a great time and a great opportunity to really, elevate that awareness of brain injury in Ohio.
Absolutely. And if somebody wants to contact you, just reach out, right? I mean,
Yep.
a call, go to the website.
Absolutely, absolutely. You can go, probably the best place to go is our website, www.biaoh.org, and you can contact us in a variety of ways from there.
All right. Very interesting take on this. Thank you so much for being with us today.
Thank you so much for having us.